the death rate in asthma in certain parts of the country is going up.
Mm-hmm.
Why?
That's a good question. We're not really sure. Again, there's a lot of work over the past 5 or 10 years by several research groups in the country, including our own, which have started to identify genetic risk factors for severe asthma. And some of those genetic risk factors have to do with different susceptibilities to environmental triggers as well. It's something that is not completely worked out well, but it's a very, very important problem that certainly needs to be addressed from a research and a clinical standpoint.
And sometimes there could be even patients that were treated correctly,
Mm-hmm.
and we still have the problem.
Yeah, I think one of the problems there is that when you're approached with a child who has very difficult to control asthma, difficult to control meaning that their symptoms are not as responsive to traditional asthma therapies as most children, then we're probably we're probably talking about a little bit of a different disease. There's something different about those children that makes their disease not responsive to these medications, and it probably is a combination of genetic.
So that's a kind of a situation. If you're not getting the control and you think they're listening to you, or they're not either way,
Yes.
that's when you got to see an expert in the field of pulmonology to go the next level to find if it's something else causing it.
Yes, that's what we believe.
Because we're trained to treat at a certain level, but I always feel if the kid is chronic, at least once the kid should see a pulmonary specialist to overlook that, because it's just not a little trip for 10 minutes.
Right.
This is a trip for many, many months.